Hey, thanks for joining us. We're here today with Dr. Barber. And Dr. Barber, here's the question, big question of the day, gum disease. We hear a lot about it and why it's, we should avoid it and all that. What is it? Can you give us the whole story behind gum disease?
Yeah, sure. So gum disease is like a umbrella term for, two different types of diseases. One's gingivitis and the other's periodontitis. The difference between those two, gingivitis is just a shorter term disease. So it comes in quicker and it can be treated and goes away quicker. Whereas periodontitis is sort of the long-term effects from chronic gingivitis.
Is there ways of preventing one or both of these things?
Yeah, that's a great question. So gingivitis is caused by anything that irritates the gums. So really, even if you have something like poke the gums, it'll cause some gingivitis. But the most common cause is anything related to poor dental hygiene. So say, you don't brush or floss for a while. What happens is, you have bacteria in your mouth, which you need that to be healthy. But over time, it sets on the teeth and turns into little stones. And the analogy I give, it's kind of like a metal pipe at a beach. Sometimes you see stuff growing on it. It's a similar process to that. So these stones form and they're small and sharp. And so they irritate the gums, and then that causes some inflammation, which leads to gingivitis.
What, if that's happening, how can it be treated?
Well, first of all, the best way to prevent it is just, good brushing and flossing twice a day, every day kind of thing.
Yep.
Reversing gingivitis is essentially what we do with the cleaning. We kind of scrape those little stones off the teeth. Make sure they're not sitting there irritating the gums anymore.
So the best symptom of gum disease, do you feel anything? Is it bad breath? What is it that's going, I got something going on here?
Yeah, there's a lot of signs and symptoms. Your gums shouldn't bleed when you floss. So if they are bleeding, that's a sign of some gingivitis. Yeah, if you got some, bad breath, some odors, that could be related to gingivitis as well. Jumping over to the periodontitis side, the long-term disease, you'll actually, if gingivitis sticks around long enough, you'll notice say this is a tooth, you'll notice the gums kind of recede on that tooth. So the teeth look longer, or they might get more sensitive. And if it happens for a lifetime, the teeth could even get loose. And so that's why we really try to prevent these gum diseases.
And that's all a great reason for people to brush your teeth, floss your teeth every morning, every night, and between every meal. Is that how it works?
Absolutely.
Hey, well, Dr. Barber, thanks so much for sharing that with the folks here. And remember, if you want to see more videos just like this, just visit rocksidefamilydentalcare.com and you'll find lots more helpful advice like this. And of course, all the dentists, Dr. Barber, and everybody else there is ready to help you if you need it. Just contact them. Thanks again, Dr. Barber.
Thank you.